Hi everyone, this is Michael Castanon again, coming to you live from ASCP's 2017 annual meeting exhibit hall, and I am here with the top winning poster, and I am here with Geoff, who worked on this poster himself. Why don't you give us a little background on your research and everything?
Yeah, so in New York State we have a really unique medical marijuana program. We don't allow any smokable dosage forms, and the THC and CBD content of the products is verified by an independent laboratory. So the label of our products accurately reflects what's actually inside the dosage. So basically all our patients had chronic pain in one way or the other. We had 36 patients at our clinic, and we followed them over the course of 3 months treatment, and we measured this pain quality assessment scale, which is a pretty unique pain scale. It's not just the standard 0 to 10 faces, 10 being the worst pain you've ever had in your life, 0 being no pain at all. This one actually makes patients really think about their pain and describe it using all these different descriptor terms. So we looked at that at baseline, and then we looked at that at 3 months later, and we found patients had good responses in all 3 categories of our factor analysis, which is over here. We also looked at just 0 to 10 pain rating scale, and most of our patients were miserable at about an 8 before using medical marijuana, and then over the course of 3 months treatment, they brought their pain down to a 2. We also looked at quality of life, and we looked at depression and anxiety as well. That was a criticism we got in the spring when we presented this data. People wanted to know if medical marijuana was adversely affecting like anxiety or depression. So we added that to this year's presentation, and basically what we found is none of our patients had anxiety or depression at baseline, but medical marijuana definitely didn't worsen anxiety or depression rating scores. Our medical director is a psychiatrist, so he already incorporates depression and anxiety rating scales into his practice, and we already had that data available, so we just added that. And basically our long-term goal is to establish dose response once we get a few more patients, and we'll have about 50 patients next year at this time, and we'll be able to present 6-month data. So we'll be looking at this similar metrics, and we're going to evaluate it every 3 months. The other thing we did that was really cool is we looked at patients' opioid doses, and we followed it over the course of 3 months. So we converted all their opioid analgesics to morphine equivalents and followed it over 3 months, and all but 3 of our patients were able to completely discontinue their opioids. So
Oh, wow.
that was a pretty compelling or awesome finding that we had. We looked at cost too, but that was kind of limited by what pricing data we had. We only have average wholesale price for the opioid prescriptions, but right now a big thing that's limiting the medical marijuana program in New York State is the cost of medical marijuana. Since the state limits the amount of dispensaries, there's no competition in price between dispensaries, so medical marijuana isn't the cheapest thing right now for patients.
Okay, wow. And I heard you say something about getting some criticisms on it, and I know medical marijuana is kind of a taboo subject, but how does it feel getting first place here?
Oh, it feels amazing. We're excited about it. We're glad that people showed interest in the topic, and that people are coming to talk to us, and that people are excited about it. So
That's awesome. So I see that you have a first-year ribbon. How does it feel to be at your very first ASCP annual meeting?
it feels good. I've never been here before, and everybody's been really nice to talk to. So
Good, I'm glad. How does it feel to win your very first time being here?
I'm thankful. It's very awesome that we won. So appreciate everybody's interest in our topic. So
Awesome. And do you have any special shout-outs for anyone who might be watching?
no, thank you.
All right. Well, thank you so much. Congratulations again on your poster.
Thank you.
Coming to you live from Orlando, Florida at ASCP's 2017 annual meeting, I am Michael Castanon. Make sure to keep tuning in for more Facebook Lives. See you later.